Hey, this is Professor Fay with your anatomy lesson of the day. Today we're going to talk about the female reproductive system. So I've got a female pelvic cavity model with me here. This would be the right hip and the right thigh. And then if we move medially, the best view of most of these organs is from a mid-sagittal view. So externally, we have the labium majus and the labium minus. Plural version is labia majora and labia minora. And then you can see here, this is the urinary bladder and the urethra. So you can see where that opens externally. Anteriorly, we have the clitoris. And then just behind the urethra, we have the vaginal orifice and vagina here. So then if we move and we look at this, this is the uterus. So the uterus has a few components to its wall. The endometrium is the inner lining. The middle is the myometrium. And then around it all, part of the visceral peritoneum is the periometrium. So then the uterus has an the anterior-most portion of it is the fundus. The middle portion of it is the body. And this is the cervix area here. There's a little canal within the cervix. And so that's called the internal os, the beginning of the canal. And then we've got that canal and then the external os. The vagina have these sort of folds. You can see that, and so those are called rugae. And then if we look just lateral to the uterus, you can see that there's an ovary here on like kind of the lateral aspect of the pelvic cavity wall. And then it's covered by these little sort of strands are called fimbriae. And then we've got the infundibulum of the uterine tube. The middle portion is called the ampulla of the uterine tube. And then the part that goes right into the uterus is called the isthmus of the uterine tube. So basically, the egg develops in the ovary. It gets ovulated or ejected. The fimbriae sweep it into the uterine tube, and then it passes through this uterine tube on its way to the uterus. So that is the female reproductive system.